So you have diabetic retinopathy, there's bleeding and swelling and everything. You've gotten some eye injections, things are better, but now what's the next step? What's maintenance like? What is good control like in the long term? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. Maintenance of diabetic retinopathy is a pretty complex subject, and it involves 4 treatment strategies depending on the situation. Treatment strategy number 1 is what people with diabetes do, which that is outside of the eye clinic. Staying on top of blood pressure, cholesterol, blood sugar, making sure that the A1C is like 6.5% or so. If you do that, eventually, it'll take years, but eventually the retina will start to behave. Thing number 2 is inject the eye regularly. Thing number 3 is perform a laser procedure. And thing number 4 is eye surgery. Injecting the eye regularly, that is, let's say every 3 months or so, at least for the control or the prevention of bleeding inside of the eye, is a viable way of preventing bleeding inside of the eye. The main disadvantage of injecting the eye regularly, let's say 4 times a year or every 3 months, is that you have to keep going back. When you inject the eye with medication, it wears away, and then all of the processes that lead to bleeding and swelling and stuff like that, they start to come back, and so someone has to be redosed. The advantage of a laser procedure, otherwise known as panretinal photocoagulation, is that for most people, when enough laser has been delivered, when you've worked for months and months and months, and you've gone through the whole headache of feeling the bright light, feeling the zings, the electrical pulses, investing a lot of time, eventually the bleeding aspect of diabetic retinopathy is cured. The disadvantage, though, of that is that it's a pain. It's a big investment. It's really hard to do. Each session of laser is bright. It causes a headache. You feel these pulsating, stabby feelings every time a laser spot is applied, and there are thousands of laser spots that are applied every session. It's a lot of work. Laser can also cause the peripheral vision to be lost permanently. It can also harm nighttime vision. These risks tend to be a little overemphasized when we say them. Naturally, people say, oh, I will develop that. Not necessarily true, not with modern technology, but still, those are risks. Surgery is performed when someone has diabetic retinopathy and there's been bleeding in the past, and after all sorts of injections, the bleeding has stopped, and yet the blood hasn't cleared away sufficiently, and people have lots of floaters, let's say, or there's scar tissue that's formed on the retina. It's caused, let's say, an epiretinal membrane or even a retinal detachment off to the side. In that case, a retina specialist might recommend a surgery. When we have evaluated these statements in clinical trials, specifically comparing eye injections to a laser procedure,